My name is Joellen Thompson, and I've been a physical therapist for 42 years. I'm currently retired. Probably 30 of those 42 years I spent in home care, so I was very familiar with working with patients with the total knee replacement, but my point of emphasis would have been at home when they were still homebound and trying to get them to the outpatient clinic. Now, 2 months ago, I had my first and hopefully my only total knee replacement. And so now I was looking at, I fortunately did not have any home care. I came home one day from after the surgery, and the next day I was in therapy as an outpatient, so I kind of missed that whole in-between bit. But I knew how tough gaining motion is after knee replacements. I knew that, really had to work on terminal knee extension is one of the biggest factors, because preoperatively, typically people have walked with a limp and therefore they have a quad lag or they have a knee flexion contracture. So, I knew that this was the most important part that I could do pre-op, and then of course post-op, grinding out that range of motion for terminal, the flexion. I knew that would not be anything easy. Although I've learned there are some people who are blessed filing total knee replacements and they gain their motion very easily, but most have difficulty. It's just part of the game. So when I was receiving physical therapy, and the therapist who I worked with was also somebody who we were colleagues years ago, so I knew him, and surgeons respect him. He does an excellent job, and I was very confident in his hands. What for me was difficult was going through a very rigorous physical therapy session, making a small amount of improvement with, of course, pain that accompanies trying to gain that type of motion, and then trying to come home and maintain what was gained in therapy in the home front. And what I would find is I could not do that. No matter how much pain I could force my knee, trying to get motion, it still was not what I had achieved in the clinic situation. So once I started using the OrthoBike for home use, I found out that now I finally had the ability to maintain, and maybe in some cases as time marched on and I became more expert in using the different adjustments in the OrthoBike, I was able to actually increase it. So the next time I would go in for therapy, what previously had been a very physically excruciating experience for trying to gain that range of motion was now coming much easier. And so I credit the ability to use the OrthoBike. The other aspect to me, which could not be measured range of motion or muscle strength wise or anything, but during those first couple weeks, I almost think I was extremely frustrated and depressed that as a physical therapist, how am I not being able to do, or what am I doing wrong that I cannot make these gains on a better timeline? And although each time in therapy with a therapist you could always make the gains, but it was nothing I could do. So by having the OrthoBike, it allowed me to develop the confidence that yes, I could do this on my own. I could maintain those gains.